Say goodbye to back pain in just 8 minutes. You can relieve tension, discomfort with these 5 simple exercises. Whether you're dealing with chronic back pain, sciatica, or you just need a quick stretch break, this video's got you covered. Follow along as we guide you through a series of gentle movements designed to loosen up your tight muscles, improve your back mobility, and leave you feeling relaxed and refreshed. Try incorporating these exercises into your daily routine and start feeling the benefit for yourself. Back pain can be a real game changer, affecting every aspect of your daily life, from struggling to get out of bed in the morning to feeling drained or a long day at work. It's just a constant reminder that something needs to change. For many of us, back pain has become an unwanted companion, making everyday activities a challenge. It's estimated that millions of people worldwide suffer from back pain. And it's not just about the physical discomfort. It can impact your mood, your energy levels, and your overall well-being, as well as our relationships and work performance. I know firsthand how frustrating and debilitating it can be. The good news is we have helped thousands and thousands of clients get their life back and manage and alleviate back pain without resorting to medications or surgery. By incorporating these 5 simple exercises into your daily routine, you can start experiencing relief and getting back to living your life to the fullest. So let's get started. So the first thing that I want to talk about that we have to address first is mobility. So I'm going to show you a mobility exercise, but let's get into why mobility is key. If we can't physically move, then you're not going to be able to activate muscles to get those to kind of fire correctly. You're going to have compensation patterns. And so the first thing that people do when you go off to a physical therapist is let's do core strengthening. Let's do some flexibility exercises, whatever. That's all well and good, but it's not going to work if you have a lack of mobility. And so what do I mean by that? How do the joints move through the back? And so if we have things like, and these are the most common things that we hear, that when we go through all these exercises that we're going to tell you about, this is the perfect case. It's 80% of the people. They typically hurt when they sit for a while, they get up, and it's kind of hard to kind of straighten up and start walking. They notice bending gives them a hard time. If they start walking long enough, it feels actually better. They like to stand, they like to lie flat. These are all things that we hear. And when we hear this, then this video really is for you, because we're going to go through some easy things that you can start with that literally is going to take you 8 minutes to do, and it's going to be a game changer. So mobility is the first one, and because of all those things that I just described, a lot of times it's the bending, it's the sitting that gives us problems, because we end up sitting and we'll sit slouched, and so our joints don't like being in this position, and we never reverse it. That's what we have to do, is just reverse it. So this exercise for mobility that we're going to do is reversing it. It's my favorite one. I do this all the time myself. I usually incorporate it after I do workouts because I'm super warm and I want to just make sure that I maintain it. And it's a way for me just to incorporate it into my daily life. But if you're noticing that you're pretty stiff and you're having some issues, I would do this exercise every couple of hours just to offset all the bending that you're doing to start getting you some pretty quick relief. So hands are going to be underneath the shoulders here, and then we're just going to kind of come up and just kind of relax into it. And you may feel some pinching or tightness in the back. I'm actually okay with that, especially if everything that I just described with the sitting and having a hard time getting up, and those things are what make you hurt, and the bending that makes you hurt. I'm okay. You're going to feel a little bit, but as you keep on going, you should notice that it gets a little bit easier. And so I would do 8 to 10 of these. You can kind of hold it for a little bit, coming back down. Now, you may look like this because you don't have as much flexibility as I have. That's okay. If you're stiff as a board, all you have to do is breathe. So if I breathe, your body will relax and will be able to arch a little bit more. So if you're looking like this and you're stiff as a board, just breathe out, and you'll notice that you'll get a little bit more mobility. You won't look like me, but that's okay. So doing 8 to 10 of those. and do them every couple of hours if you're noticing that you're having some back pain, will be huge. You can also do some, they're standing, this exercise lying down usually works the best, but you can also stand and just kind of extend, just kind of put your hands on your hips and just arch back to just increase that mobility of that lower back. So that's the first thing that you should be doing. The second thing is posture. Posture is huge. So if you're, again, going through those same scenarios, sitting hurts, it hurts to stand up from sitting. If I get walking, it feels a little bit better. I feel better when I lie down, all those things, then posture is huge. So it's kind of like if I pull my finger back and I hold it back like this, it doesn't matter what exercise I do, it's the finger pulling back that's the problem. And so this is where people don't get into your daily life, your daily activities that really can help with improving. Like these are the things, it's kind of like stabbing a wound. So if you're stabbing the wound, it never gets better, but you're doing all the things to make the wound heal, but you keep on stabbing it. That's what happens with our daily activities that we're doing. We have to bring awareness around some of those things. So sitting, huge thing. We use things called lumbar rolls. These are McKenzie lumbar rolls is what they're called. And so when you want to sit, you're going to want to sit in a chair all the way back. So let's say just is all the way back into, so I'm going sideways. The chair is hitting you here and your hips go all the way back. Obviously your legs are going to go in front, but you're going to use this to put down into the chair to kind of hit that lower level so that when you are sitting up, it's going to make you sit in a much better posture where the joints are going to be on top of each other, not off like this where they don't like being in these positions for a very long period of time. It's going to maintain that good position. And if we can maintain that and we keep the body in a better position, the healing of everything will speed up. So that's the second thing that we should be doing. Now, the next things are, I'm going to give you a couple of strengthening things. And when we do the strengthening things, we want to move into extension because that's the direction that our body feels better in on opening everything up. But it's also going to get those muscles to contract and relax. And so I love this exercise. It's one of my favorite ones. You're going to use a band to put around your knees. So you put around your knees. You're going to lie on your back. So what we're going to do is we're going to lift our hips up in the bridging. So we're doing this so that we can really get as high as you can go, get those muscles in the back, get that back to move into extension. And then you're going to pull the legs apart. Now, when I pull the legs apart, think of my hands as the pelvis. My legs pull apart. It's going to give you a little bit of a mobilization in that lower back. It feels really good. So you'll just, again, go down. You'll come up as high as you can go, pull the legs apart, bring it back together, and then come back down. And again, on these, I would do them about 10 to 15 times. On this type of exercise, you can do it once a day. You can do it twice a day, kind of as needed. Not as big of a deal because we're just trying to start working on getting a little bit of the strength back in there, as well as moving the body into a little bit of extension. So the next exercise, very similar. We're going to do it where you're doing a little bit of extension on each side. You're going to have one leg up and one leg down. So when you do this, this knee would stay up toward the ceiling. So you don't want to roll where this knee is rolling. We want to actually push and extend that one side. So that knee stays up and it's like I'm rolling on the hip. So I'm not lifting both sides, you're just lifting one glute as you roll, keeping that knee toward the ceiling. This one also feels really good. We call it the unilateral hip extension. You're gonna get the hip kind of start to fire. You're gonna get the lower back to kind of start to fire on this one side. So let me show you on the other side. You'll do it on both sides. This knee stays up to the ceiling and you're just pushing and rolling. So this hip stays on the ground as you roll and you come back up. Pushing down, lifting up. This one, again, it feels really good because you're getting the hip to extend, to get those to kind of start firing. You're getting your back muscles to kind of start firing. You're moving the back into some extension. All of those will really help improve the mobility, moving into the direction of extension, but also getting those muscles to contract, relax, which helps calm everything down. Now, the last thing that you're going to do, you're going to use a tennis ball. So if your mobility is improving, like your range of motion going backwards is getting better, you'll get a lot of protection. A lot of times with the back, it's gonna refer into the hip. It's gonna refer pain into the hip. So when that happens, where it refers the pain in there, your muscles are gonna tense up and protect. So if you go and you get a massage, because you're like, oh, I'm gonna get a massage on my back and get a massage on my hip, and I feel better, but it comes right back again, that's because you're not fixing the problem. So us, by improving your mobility in your back, we're actually fixing the problem, and then you can go and use a tennis ball to finish up releasing some tightness that has been there for a while, or the tissues have just shortened. And a common place for that tightness is gonna be in the hip. It's either gonna be really close to where that SI joint is, or it's gonna be a little bit more on that lateral side. So what you're gonna do is you're gonna use the tennis ball to release that. So you'll just lift up and you'll hit the hip. Now, if you go higher up, I can roll to the side to kind of find if there's any tightness through there. And so you'll just kind of roll. When you feel the tightness, you just kind of hang out there and you just breathe and just get everything to kind of relax. If you want to go a little bit lower in the hip, you're gonna have to sit up. So now I can roll a little bit lower, do the same thing, roll and hit parts of the hip that are just a little tight because of the pain that's been there. The muscles will protect, tensing up. And so just do that. Hold that for just a little bit as you roll through there. That's gonna release a lot of the tightness that you have that's coming from that back. But again, that tightness will come back again if you don't do that first exercise for improving that mobility. So do that maybe for a minute, 2 minutes. You may be a little sore like the next day. You might feel like there's a little bit of a bruise if you just kind of rub your hand across your glutes there a little bit, but that's gonna feel way better than the pain that you were having. So again, these exercises don't take very long, but they are definitely exercises that will start giving you relief pretty quickly by doing them. Now, if you like our content, make sure you subscribe to our channel, because we're getting more and more people that are viewing it, which is so great, because our whole goal is to help provide education and think about the body in a little bit of a different way than just traditional PT thinks. And so we're very, very different in that way. We really help the clients that have tried everything, nothing's worked, and they're wanting to avoid surgery, and we're able to help them navigate that much better. Make sure if you have any comments, comment and go in the comment section and ask us any kind of questions that you have. We definitely reach back out to you and learn a little bit more. In the description, there's a lot of other resources. We have a free back pain report that you can download to learn more about. We also have my book. I wrote a book about a year ago, and it really goes into all the different body parts and understanding the body parts, but from a patient's perspective of patient stories, so you can kind of see like, oh my gosh, that sounds like me. So it's another great resource that's actually in the description as well as other ways that you can kind of work with us. So I think that's it. I'll see you next time.